I start by presenting Emil Billbäck, CEO of BoneSupport. A warm welcome.
Thank you.
Please, Emil, the stage is yours.
English, right?
English.
So when Torbjörn was talking in Swedish, I had to reformulate a lot of my speech today and think, what is that actually in Swedish? Because some of the terms I will use, I actually don't even know the word. I was also here 3 years ago, and it's always difficult to take the stage after you. Thank you very much. Fantastic gold nuggets and a lot of wisdom. My presentation will be different. It will be more on trying to transmit to you what is BoneSupport, what is the business status, and what is the journey we're on. Some of the numbers I will show are Q2 numbers. It's not because I haven't had the time to update my presentation, but our Q3 results are released tomorrow morning. So hopefully it will be 24 hours of excitement now with some interesting information here and then keeping you a little bit on the hotbed until tomorrow. This presentation is available from Vator, so there are some disclaimers also here. I would like to thank the whole Vator team for the invitation. We have a great partnership with Vator. We're not a customer, but we think it's an excellent institution which is disrupting the industry, which we also are doing, but we are in the orthopedics, they are in the finance. So our entire company is built around a unique technology for healing bones, for bone healing. And there's a famous saying that the necessity is the mother of all invention. And I'm very proud to say that our company has actually sprung out of a true medical need. So 20 years ago, a group of scientists and clinicians, so doctors, orthopedic surgeons treating patients in Lund, sat down at a coffee table and said, there must be a smarter way of treating bone injuries. There must be a way of creating a synthetic product that mimics natural healing. Voila, 20 years later, here we are. We are in commercial phase since 2013. And yes, Q2 LTM sales, so last 12 months, it's about 260 million SEK. The pandemic was tough on us, as on most companies in the surgical industry, because the elective procedures were postponed, deferred to a later date, and only life-critical surgeries were being taken under the last 2 years. Nevertheless, during this period, we grew with 30%. And year to date, again, for the first 6 months, was 46%. A healthy margin, and the way to look at this is that the customers put value on our product. Our product is significantly more expensive than the standard of care, and I will explain why and how that dynamic works. We're completely disruptive to the standard of care. So the traditional historical way of treating bone injuries is with a bone transplant, either from a person that recently died, where you can harvest the skeleton, or from the patient itself, where you take a piece of the bone which the doctor will deem not so necessary. I like my bones, I don't want any of it to be taken actually, but usually they take a piece of the iliac crest, or hip bone, and place it in at the site of the injury. Our solution is completely synthetic. I will share the technology on the next slide. We have more than 240 clinical studies. And it's almost like a bragging game. Whoever has the most clinical studies will win. But it's actually this, when you have a breakthrough technology, you have to show to the authorities and to the rather conservative surgeons that safety, security, biocompatibility, efficacy, tolerability, efficacy if the patient have different comorbidities. So the way to see this is that we are well researched and we've tested the product in all possible dimensions. The fact that we have so much clinical study and so much documentation also enabled us to file a submission to the FDA about 2 years and 3 months ago for our product CERAMENT G, which is eluting gentamicin. Gentamicin is an antibiotic. Why? because the most severe complication you can have with a bone injury is if bacteria starts to grow at the site of the injury. The risk of amputation increase significantly. In May of this year, after ups and downs in the interactions with FDA, we received approval for CERAMENT G. It means that a small company in Lund started from a true unmet clinical need, was the first ever in the world to have a synthetic bone healing product eluting antibiotics. And you will see on some studies, also in the results, why that is so critical. So I come back to this with a unique technology. Let me use just one slide to explain what it is that we do. We're the only company in the world that have been able to synthetically mix and produce the ceramic bone minerals that your skeleton is normally built of. We provide this in a pre-filled syringe, so it's injectable. And it means if it's injectable, you can fill the cavity with a good surface contact to your healing bone. To healthy bone, of course. And once it's injected in the injury, the healing starts within a couple of days. And CERAMENT, our product, goes through a transformation inside your body where it is resorbed by the cells that are forming the bone. So after 6 to 12 months, there is no product left. It has been completely remodeled into bone. If you do an X-ray or biopsies, histology after 12 months, the only thing you will find in there is healthy bone. Through this transformation phase, if you look at our biggest selling product, the CERAMENT G, the one that contains gentamicin antibiotic, as it goes through the transformation inside your body, it's also eluting antibiotic at a very high concentration locally. The concentration, the blue line, is significantly higher than the level you need to be sure to eliminate the bacteria. But none of it is having systemic effects, so it doesn't pass out in the rest of the system of your body. So you're treating very aggressively locally without the side effect that usually is associated with antibiotic therapy. This is the product that just got approved in the US. This is the product that we are launching right now. And to make Torbjörn happy and show that we've done our homework on Porter, I'm going to talk about what the market really looks like. 360,000 procedures per year in the US. We're focusing now on the US where we got the recent approval. 360 procedures a year where there's an injury to the bone that the patient is unable to heal by themselves. It needs surgical intervention. It needs a graft. A graft is the same as a transplant, either if you take it from your own body or it's taken from some other person's body. This is the way the market looks today. 220,000 of these 360 procedures take place under well-organized circumstances, and no local antibiotics is really needed. Here we have a product already on the US market, which is called CERAMENT BVF, Bone Void Filler. Simple, no antibiotics. It has quite nice success already on the US market, as you will see. But the piece of the market that no one has been able to solve so far is the purple part here. It's about 140,000 procedures, the dark purple and the light purple. I hope it is purple, because my color vision is impaired, unfortunately. Here, local antibiotics are used either to prevent an infection from developing, or the dark purple, when an infection already has started. And this is a critical stage where the doctor is fighting to save the leg or the arm, because amputation could be the alternative. All of the use today in the US of local antibiotics, together with bone grafts, is off-label, unauthorized use, completely to the liability of the surgeon himself or herself. The first product and the only product approved for administering local antibiotics with a graft is CERAMENT G, that launched last week, our product. We are approved in the dark purple segment, which is treating the infection when it has occurred. Immediately when we got the approval, my team, I think Torbjörn has one of the greatest team in the world. I aspire to having at least the second best team. We also focus very strongly on culture. And this team closed the book, said, yes, we'll celebrate now one evening. There was a lot of champagne. Next day, they started working on expanding the indication also to preventing an infection. The product is the only one in a market opportunity of $780 million. So yes, sorry again, Torbjörn referring to you, but we can live pretty well from this. So to be able to submit to the FDA, we had to gather a massive amount of documentation. And fortunately, my predecessors all had invested well in clinical studies. So in total, we submitted 17,000 clinical data points to the FDA and had to show that CERAMENT G was indeed superior to the standard of care, even if standard of care was not approved. The standard of care in the US is called PMMA beads. It's small plastic pellets attached on a string. It looks like a child's necklace, basically. That is dipped into antibiotics and then placed at the site of the injury. After a few days, the antibiotics that's stuck on the plastic surface has eluted, and the process is repeated until the infection is eradicated. The infection recurrence, meaning the infection comes back and you have a failure, is 13%. And this is in big patient populations where we had to do demographic matching to fulfill the needs of FDA. And we do the same with CERAMENT G, the same kind of patients, but a different process, because CERAMENT G heals the leg at the same time as it elutes antibiotics. So here you do a one-stage procedure, and here you do multiple stage procedures. You see that you can reduce the infection risk or the infection outcome significantly. The prevalence or the incidence of infection is reduced to around 5% versus 13%. And that makes a huge difference if you have a high risk of amputation given the infection in the leg. So let's look at sales. This is the final time I will refer to you, Torbjörn, I promise. Our graphs looks a bit similar, but I know you have a different scale. Yes, we're much earlier stage, but we have strong growth. This is LTM, this is last 12 months sales, shown for every quarter basically since we were going into the commercial phase in 2013. There's a lot of colors here. The blue is the US, light blue, dark blue. Started light blue, working with a big American distributor, deciding that we want to do it ourselves. We want to have independent distributors. We want to own our value proposition. We want to drive our culture to our coworkers. We want to have a short distance from the CO to the customers and not an intermediate that is creating a filter. So the dark blue is where we are right now in the US, growing very nicely, invoicing directly to customers and enjoying every day. The red and orange is Europe. The orange is the product without antibiotics, and the red is the product that elutes antibiotic. It's our blockbuster in Europe. Why? Because the surgeons in Europe, even if there's not even a single sign of infection, they use the product with antibiotics to avoid putting the patient at risk of potentially coming back anyhow with an infection, because there's no side effect, so why not use it? What is interesting here also, yes, strong growth, nice growth. You could see where the pandemic hit us, here, and surgeries shrunk all over the world with about 15%. We managed quite well, and you see that we picked up again, but it's clearly visible in our numbers. Another very interesting observation, I think, is to look the ratio between antibiotic-eluting products and the base product, the orange product, in Europe. It's a factor of 1 to 5. And then you can imagine the potential we have in the US. The dark blue bar here corresponds to the orange. We only have the base product so far in the US. And as I said, for those of you that follow us, you saw the press release we had last week, or actually it was Monday, sorry, that we have treated the first patients in the US with CERAMENT G with gentamicin. Patients with severe bone infections, very difficult conditions. There were a total of 6 hospitals that started on the very day that the product was available. So, taking just a quick look at Europe, the red and the orange. We've been in commercial phase for 7-8 years, as you saw. We have a direct organization in the northern part of Europe. We can't afford it. We're trying to be very meticulous with the money we have available, and we're working with distributors in the southern part of Europe, where you need a bigger sales force to reach out to the doctors. We're quite small so far. Only 4% of the procedures in Europe are done with CERAMENT. But if you look in the specific segment of infected wounds or where you prevent an infection, meaning the wounds where local antibiotics are used, we have in a short period of time made it to 8% market share. In these markets where we are direct, we have continued, okay, one more time, just like you, to invest through the pandemic. We have started our own entity in Netherlands. We've hired hybrid salespeople in Spain and France because we knew that one day the pandemic will start to unfold. And what was a significant headwind during the last 2 years is going to turn to a tailwind as we're going to see the biggest backlog of orthopedic surgeries ever. So in a short period of time, we have actually taken a very strong position in Europe. And why do I think that it's going to be even more impactful in the US? And this is my second to last slide. I think it's going to be even more impactful in the US because we have strong superiority data and there's no other product available. We're the only one there. We're the only one on the market, and we have already a strong penetration, as you saw from my slide with the blue bars. We're already doing quite well in the US with strong growth. On top of that, when we submitted all the documentation to the authorities, to the CMS that oversees the reimbursement structure, they decided that when CERAMENT G is used on Medicare patients, which are dominantly the old patients, but also with a lot of comorbidities, so they're quite sick. Diabetes, for example, is a complication that leads to more bone infections. When CERAMENT G is used on these patients, an extra reimbursement of $4,900 is passed to the hospital. So the authorities are giving a financial incentive for breakthroughs in certain conditions, and CERAMENT G is one of those conditions. And we have also very strong contract presence already. I will not talk more about that, but you have to listen tomorrow morning and you will know what I'm talking about. My final slide. I think there's a lot of reasons to be excited and put the alarm bell early on tomorrow morning and look at the quarterly results. We have done significant investments over the years to build a strong company, to build a strong culture, to equip ourselves with clinical evidence to disrupt the standard of care. What has been a COVID headwind is turning into a tailwind, and we are in a very good position. We have built out the hybrid markets in Europe, and most importantly, we are now launching the CERAMENT G in the US, our blockbuster European product. We started last week, and we're going full speed ahead. We had a capital markets day in September. We summarized all these points in much more detail. That presentation is available on our website. We expressed with great confidence that we have a new target for the next 3 years to grow our top line with 40%. And that, my friends, concludes this presentation. Thank you.